Okay, come on up. Yeah. Okay, everybody, welcome. Nice to see you. Thank you for being here at our monthly MedEd Grand Rounds. I'm Juliet Chamberlain, the GME manager. And just a quick reminder that the goal of these are to cover content that matters across all of our different programs and specialties. So we are honored that this month features patient safety and event reporting. So we'd like to welcome our partners from Valleywise. So Crystal Garcia is the VP of Specialty Services over Quality and Safety at Valleywise. Bill Alcock is our Patient Safety Manager here at St. Joe's. And then Karen Everitt and her colleague in the back, Robin Reithinger. They are part of our team at Mutual Insurance, our risk team. So they are who you can thank after the program for your clinical coverage and taking care of you in that space. So with that, I will turn it over to them. Thank you for being here.
We also brought goodie bags in the back for you guys. It's actually for a tasteful.
That's the important part. Good morning. So as I said, I'm the manager for patient safety here. My team, so you'll hear us refer to as patient safety, risk management, claims, patient relations, because we do all that. So really, if you have a problem, it's going to come to us at some point. Otherwise, all right, so Crystal and I are going to tag team this, and then Karen's going to. You have a great resource here. You have Micah here, so if you have any questions about claims, malpractice, they're the people to ask. So. Anything else? There we go. Yeah. All right, so today I want to talk about event reporting. So first thing is, what's an event? It's really any unusual events, unexpected occurrences. So these are events that fall outside the usual business operation or anything that's inconsistent with the facility's routine operation. You know, something happened that was wrong. Right? And this could be a near miss. This could be something that almost caused harm. You know, something happened that was wrong. It's outside of what we usually do. Luckily, it didn't cause harm, but in some ways, the near misses are the most important because we love the near misses because they didn't cause harm, but it gives us an opportunity to address a problem. So the real question is for an event report, when you have a doubt, fill one out. I'll say at St. Joe's, we don't have really great numbers of residents filling out event reports. And I know you're all very busy, so you don't have time. Most of them are filled out by nursing. But when something happens, I really urge you to go ahead and fill one out. We want to hear from you. We want you to tell your story. Don't rely on someone else to tell your story. So fill one out when there's a doubt. So again, any unanticipated error occurrence. This could be a potential, it's a near miss, could be a potential problem, could be an actual adverse event, anything that involves a patient or you. Something happens to you and you want to fill out an event report. We welcome that. Now, a serious safety event, like I said, we talked about near misses. So when we have actual harm, it may be a serious safety event, and we take those very seriously. We fully investigate them. Our executive team is involved in resolving those and coming up with action plans. So we take those very seriously at St. Joe's, and I'm sure at Valleywise too. So that's an unexpected patient safety event involving death or serious physical or psychological injury or the risk thereof. Right? So examples might be a loss of limb, permanent harm, things like that. So the risk thereof is any process or variation for which a recurrence would carry a significant chance of a serious adverse outcome. Again, those what I just talked about, you know, death, loss of limb, things like this, permanent harm. So those are things we really want to address right away. And I would really say those are really, I most want the residents to go ahead and put in an event report. It doesn't matter if someone else already did. Put one in. I will say we don't get a lot, but when we get an event report from the residents, I love them because they're chock full of detail. You guys are great writers. You know, you put a lot of important detail in, and you know, I want to hear from you. All right, so quick about patient safety organizations. Some people worry about putting event reports in because you think, oh, well, now if there's litigation, everyone's gonna see what I wrote. We both belong to patient safety organizations, and I'm not gonna read all this, but under the Patient Safety and Quality Improvement Act, it gives us protection from disclosure for our event reports. They're a patient safety work product, right? So they do not get disclosed. I don't even give them to our attorneys. And we, at least at Dignity Health, we will fight that on the national level. Our system level and our national team will fight that. And we have numerous times. We have yet to lose on that. So they are protected. So please don't feel like you can't write something in an event report because someone, is going to see it in litigation or outside of our facility. And even within our facility, it is limited on who sees that. You have to have an account in the system to see that event report. Okay. So again, what privilege mean? It means we're not giving it up in, we're not going to give it to law enforcement. We're not going to give it up in discovery in litigation, and we will fight it. I assume you would as well.
We do.
Yeah. So Valleywise will fight it too. Sorry, I lost my clicker. There we go. Okay. So that's some examples of why we report. We want to investigate things, right? It's a patient safety tool. So here at St. Joe's, we're working on becoming a highly reliable organization. That means we're dedicated to zero harm. And I know that's a lofty goal, but as Vince Lombardi once said something to the effect of, if you strive for perfection, you'll stumble upon excellence, right? So if we strive for zero harm, we will reduce our harm significantly. And other facilities that have done this have seen it. They've seen 80%, reductions in serious safety events, numbers like that. So that's what we're going for here. And event reporting is a key component of that. So it's going to help us determine what systems, processes, or workflows need to be improved to reduce harm. When harm occurs, it's usually not because of one problem. It's the Swiss cheese effect. Multiple holes in that Swiss cheese lined up, 5 different things went wrong, and that's how the harm occurred. So this allows us to look at that and figure out how to plug those holes. It also gives us the necessary information to investigate, of course, and then also necessary to analyze it and see if we have a legal claim. Do we need to call and put a claim in? I keep moving this, I apologize. All right, so what do we report? Patient falls, injuries, really any patient injuries, we would love to see that. Of course, child or adult abductions, unexpected deaths. This is a hospital. We do have expected deaths, so we're really worried about something unexpected. I'll point out allegations of abuse. We have an entire, at least at St. Joe's, we have an entire abuse allegation team. So when there's an allegation of of abuse, and that includes executives, our division level, there's a complete investigation on that. So if you hear any patients letting you know about an allegation of abuse, please put an event report in. We take those very seriously. Any medication errors, attempted suicides, missing documentation, delays in care, things like that. But definitely anything you are personally involved in, I urge you to put an event report in and tell your story. So what are we going to put in there, right? Well, use factual terms, right? We want the facts, not opinion, unless it's really like a medical opinion. So complete all the sections and we'll go over the 2 different systems. They're very easy to use. Do it as soon as possible. But really, who, what, when, where, why? Use your senses. What you see, what you hear, not what you tasted. We don't do that in the hospital. Do not reference. Also, if it's important enough to put an event report in, you should probably write something in the chart about what happened, right? In most cases, if it involves a patient. Sometimes we get these long, beautiful event reports with a great story and there's nothing in the chart. Put a note in, put it in your note, but do not reference that you completed an event report, right? Remember, we're trying to avoid that fight about the patient safety work product. Don't use subjective comments, characterizations. Don't throw people under the bus. accusations, conclusions, don't use inappropriate descriptions and adjectives. If you are quoting maybe some profanity, for example, please put it in quotes. And, also, don't ever print an event report. So when we start printing these things and they're starting to get around, we could then lose that privilege we have. So please maintain confidentiality. Don't discuss it in the break room with everyone that can hear you. All right, and Crystal's gonna talk about theirs here.
All right, so thank you. So with Valleywise, again, Bill and our health systems use two different types of reporting systems. So at Valleywise, you'll see what we call Check It, as well as we kind of use it interchangeably MIDA system. Again, it's an electronic form for documenting the important patient safety events online. That way it's easier to track and trend and get more data from those reports that are put in. Again, events also called errors or occurrences. You'll hear them used interchangeably. Again, it's part of the patient safety program, and it determines which systems, processes, and workflows need to be improved to reduce the risk of patient harm. It's so important, to be able to receive those patient events, safety events, so then we can make those improvements. If we're not seeing those come through the system, then we're not able to make those improvements and things might be happening out there. So it's very important to enter those. A couple of tips for using, and I know Bill had said, enter data as soon as you can after the event. That just helps you with your memory, what's there, what occurred. It's factual, and as if it's a day or so later, then things can play into what you're entering in. But we truly just want the true facts of what occurred at the moment or the day that it happened. Again, once we do put it into the system, we don't want you to think it just goes out into cyberland. It does get immediately routed to the unit manager and director for them to begin following up. And timely reporting is important. I can't stress it enough. And as well as though it goes to the manager and directors of the unit that it occurred on, all of the patient safety events go to the patient safety program managers. And at Valleywise, we have two individuals that look at every patient safety event that comes through. So again, they do get routed and followed up on. As part of using the online system, just be alert of the timer that is on there. It does have a 30-minute limit to enter the event. And so as you'll see when I go through the slides, again, always making sure you save it and it's there, but you do have a timeline with entering that. So again, accessing our Check It system, it is on when you're at Valleywise, what we call the Vine, so the intranet. So you'll just go to where we have, it's the main page, it says see all apps, and then you'll get to where it says Check It and then MIDA. So that's where you would begin. And then you select a form that down drops. As you can see, there's behavioral events, blood and blood products, just various patient rights, medications. So you select the one that you feel is most appropriate. If you're not certain, it's okay. Pick the one that's closest, because we do have our patient safety program managers, as I said, they on the back end go and double check and make sure it is routed and appropriate to the category that truly is needed. When you are in the system, it does, it defaults to Valleywise Health, and that field cannot be edited. Any of the bold items that you may see when you're in the system, those are required. If you don't fill those out, the system is not going to move forward. So again, any area that you see that is bolded, you have to fill those out. Event date is required. And then on the form on the data entry side, you'll see at the very top, there's 3 different sections that is available to complete. And so you're able to complete more information. Also in there is the person entering the occurrence a resident. We added that a couple of years ago. As Bill said, we don't always see a numerous amount come from residents. We want you guys to report. It's important to report. But we do have a way to track whether it has been reported by a resident or not. And we did make that a required field, so it does have to be answered. And again, I wanted to show on this page, you can see the help, if you needed help, it's there on the right. Also on the bottom left is the timer. So as you're entering all of the information in there, just be aware of the timer that you have. So then you don't lose your work. And again, also in one of the sections, there is an area where you can just type in your comments, and that's where you would type in just the facts of what happened and just give a little bit more detail of why the occurrence and what happened during that time. But again, on this slide, just wanted to point out, once all fields are entered, save your work. It's very important for you to be able to save that. So then it does get automatically routed. Again, a couple of other tips that I've already mentioned. Again, once the events are entered, they're routed to the correct person for the follow-up. And again, patient safety program managers, we have 2 at this time instead of 3. At one point we had 3. Also, events are tracked and trend. And again, those events that are tracked and trend, we do present those at our various committees that we have at Valleywise Health. One is called Inpatient Care and Safety. And then, of course, all of that information flows up to what we call a Quality Management Council, which has executive leaders, board member on there to look at this and see what areas we need to make improvements. So, and again, that ultimately goes up to our board of directors meeting. So again, these don't go out into cyberland. We do look at we track and trend the data. We don't talk about the details of, as Bill said, those are protected, the details. But if we're seeing occurrences come through that have falls, we're going to be looking at falls in general from an organization standpoint to learn how we can make those improvements. This is just an example as I wanted, we track medication errors. We just track the number. And so this information would be something that we present at our Inpatient Care and Safety Committee. We look at that. We look at where the medication errors occur. And we get that information from our patient safety events that we would want you guys to put in. This also includes, as Bill stated, the near misses for anything with medications. That way we can make improvements on the whole process. And then also at Valleywise is our serious events, serious reportable events. Again, just the importance of if there is a serious event that occurs, and that would be really important for you to put in the patient safety event to tell, as Bill said, your story so we can hear, from you. As these do come in, we do take them very seriously. Again, they are, executive level, up to executive level to be looked at. You may hear from a patient safety program manager as we may be doing a root cause analysis. When we do those root cause analysis, we really want your feedback and hear your story, the processes that were broke as to why the serious event occurred. And then we develop action plans, and it's those action plans that we will, focus on and make sure we're making all of the necessary corrections. Also, again, as Bill stated, we are part of patient safety organization, and Valleywise is part of what we call ECRI. And that's where we get our protections, our patient safety work products, and our patient safety events, our root cause analysis. Anything from a quality standpoint falls under patient safety work product and has some extra layer of protection. Again, this is just, as I had said, I don't want to read the whole slide, just about root cause analysis. If there's a serious event, then there's usually a root cause analysis that follows. And, our patient safety program managers may reach out to speak with you to find out what happened during that time frame and during the event. And this, I just wanted to include the importance of kind of notification if those serious events happen, if you're aware how they can go up the chain of command. So then we're all aware and within our organization that an event has occurred, and then we can start working from a patient safety risk side on what we need to follow up with. Then I'll turn it over to Bill.
All right, so a lot of it's very similar. It just, it's a different program at St. Joe's. So if you look on any desktop in the hospital, hopefully every desktop when we transitioned, we apparently had computers we didn't know existed, and IT didn't know existed, which was the scary part. But this Iris reporter, that's what you're gonna see on the desktop. You click on that and you enter the event reporting. If you really wanted to, you can go in any browser. It is web-based, so I don't know why you would want to save that link and do it from somewhere else, but you could if you wanted to. So when you click that link, you get the splash screen. So again, it's very intuitive. You just pick a category. And when you hover over those categories, I think the next one has it. So if you hover over each category, it gives you the different subtypes of what you can put in. So if you're not sure, just hover over the category. It'll show you the different examples. If that's not right, then try a different category. Because of that, we end up with a lot of other patient care. It tends to be one of our top, and under other, there's a subtype of other. So other is our most popular category. But whatever you put in, we could always change it. We look at every event report that's put in. It's me and my program managers. So we could always change them. So don't get too caught up on the category. We don't get a lot of resident event reports. I'm okay if you put everyone in under other. We could fix it. One important thing is if you notice the exposure. So if you have a needle stick or any kind of exposure, please put in a report. So then we can work with Crichton on getting you the right, whatever treatment you need or testing or anything like that. That'll also allow us to work with the patient on if we need testing from the patient as well. All right. So how do you complete it? Well, you open up the form and anything with an asterisk, you have to put in as mandatory. So like I said, it's very self-explanatory. Well, I'll just point out a few things. The department for review, you'll see in there's a department for review and then a location. The reason for that is the department for review is who do we think needs to look at this? In most cases, the people reviewing for the department are the managers and supervisors or sometimes the directors. Here, because of our size, usually directors are just getting notified. They're not actually in there putting something in the event. Then where the event occurred, right? So the perfect example is there's a problem with lab, right? So we want the lab to review it because a phlebotomist did something or the lab itself had a problem with the test, but it occurred on the unit. So you put the unit where it occurred and then who needs to review it. What that will do is that notifies the reviewers for the lab. We allow up to 3 reviewers per department. It also notifies the 3 reviewers for the unit. So you have three people in in leadership looking at this event and investigating for each department. So again, incident type. So we're going to have that category and we're going to have the incident type. So you can see this says other patient care. So for this example, I picked other. You have to put whether the patient was harmed or not, right? So we immediately jump on when we see patient harm, those are ones we go in first, right? So it allows us to know that this is important. We need to look at it. You have to put in a summary event. Again, this is the, what, when, where, this is what happened. Of course, the date of event and the time of event. The reason we do the time is it really helps us with tracking when things are happening. Just recently we had assumptions that our falls were happening probably on the evenings and weekends when there's less people around. That was not the case. They're actually happening during the day when everyone's around. So this allows us to track things. So please don't use names, use titles. Right. So if you're talking about the charge nurse, put charge RN, and maybe if there's more than one, you can put initials, but we really prefer you not to put names in. And again, just facts, no opinions, definitely no name calling. We get that sometimes, unfortunately. The wrong way, I apologize. All right. So when we're picking a location, this is just what it looks like. We have a lot of departments and units here in the hospital, as you can imagine. Right? So first you choose whether it's here at St. Joe's. We also have Westgate. Under this instance, we have Dignity Health Medical Group. So you may be in the clinic. You may want to put it under the clinic. So you have a choice of picking Dignity Health Medical Group, then that'll change your departments that you have to view. There is a little search. So if you know the name of the department, you can start typing it in. Hopefully what we named it is what you call it. That's not always the case though, so you might just have to scroll. I keep losing my cursor, I apologize. These are optional, but I really prefer if you can put your name in. Anonymous reporting is of course okay. But we can, if we have more questions, we can't call you if we don't know who put it in. And on that other slide, if you do include your email, you'll get notification that you put the event in, a thank you, and you'll also know when it was closed by us. Unfortunately, we get over 1,000 events a month. We can't call everyone and follow up on every event, but depending on what it is, we may call you and follow up. So here the subtype. This is what I told you. When you hover over the event category, the type, you will see all the subtypes. So this is where you choose that, and it is a mandatory field. This is a fall. Once you put in a subtype, so this is a dynamic system. As you put things in, different things will open up and become available for you to fill out, and some things will not. So as you fill it out, it gives you different options. So just an example on the incident type and subtype. For example, if you had a blood sample, and you wouldn't be putting this one in, but let's try. If a medication is given in a wrong dose, you're going to pick medication. Oh, it should say incorrect dose. I apologize. Or delay in obtaining an MRI is going to be lab or radiology diagnostic test, and then delay. So just look at those subtypes and pick what works best. Again, we could fix it on the back end, so I don't want you to get too focused on that. Most important thing I want from you is really your summary and your description, what happened and what you think about it. Yeah, there's just more examples. Do these slides go out? Okay, thank you. So you'll receive this if you want to look at these. Just examples of different types and subtypes. So what happens once you put it in? Like I said, the department reviewers will investigate and they'll take necessary action, right? So any serious safety events, we will really investigate those. Every serious safety event gets some kind of a root cause analysis or sometimes we know the cause, so we're just going to kind of move on to action plan. Every serious safety event is reviewed by our executive team in detail, as well as the director of quality, myself, and our chief of staff. So we have a lot of eyes on them. All events get scored from a severity level of 1 to 9, with 1 being no harm, nothing happened, to death. We track and trend events as Crystal was talking about, and that tracking and trending all goes to Patient Safety Council, and then rolls up to Quality Council and then up to the board. And all serious safety events also, in addition to this, that serious safety team, which I mentioned, which is our executive team, as well as our chief of staff, they also get presented individually at Patient Safety Council by the directors of the department. Right. So just an example of our total events. We're pretty steady. We don't have a lot of changes. We're anywhere from 800 to 1,100. So as you can see, for last year, we had 10,346 events entered. This is the types, behavioral. The reason that's so high is every ED AMA gets put in there. So we consider that a behavioral. So the bulk of those are your AMAs, elopements left without being seen from the ED. But something that you're probably all aware of, we are seeing more behavioral from patients, more events of violence. So certainly if you see any of that, please put an event report in. If you have any violence against you or you observe any by a patient or staff, that's something we're looking very closely at right now. It's a problem nationally in healthcare. So we're taking those very seriously and putting in action plans on how we can prevent that and keep our staff safe. And that includes all of you. So please let us know about that. And then as you can see, the other is our other favorite category. So feel free to join the club and put them in as under other. You losing my cursor here. Okay, any questions?
Question. What if there's an incident involving 2 or 3 physicians? Who would complete the incident report?
Oh, so you could decide amongst yourselves whether who's gonna complete it, or you can all complete it. We're able to merge these. So we have no problem with, getting 10 event reports on the same issue. The more information, the better.
That's the same for Valleywise as well. Again, they could decide if one person wants to put it in, or if they all 3 want to put in their view on it and what happened from their perspective. That's great too.
And if you have any questions about whether you really, if in doubt, just put one in and don't worry about whether someone else did. There's also a risk pager, which I can't remember the number offhand right now, 746 something. But every charge nurse knows it. It's on every unit. So me and my team, we rotate it. So someone is on 24/7 on that pager. The number will be changed. Finally giving us a cell phone instead of the 80s pagers that you all have. And we have, it's so hard to find a payphone to call back on these days. So we're upgrading the technology to an old iPhone. But yeah, call us anytime. We're always happy to help out our physician team with any questions.
Go ahead, I'm sorry.
I was just gonna ask, what happens when a patient makes a report? Do those get entered into the system, and what does that follow up look like?
So as a complaint?
Yeah.
So they kind of go in the same system. It's a different module. We keep that separate from because that doesn't have the same protection. So we put that in our, it's called our GMIS system as a complaint, or sometimes a grievance, depending on how we received it and whether we're able to resolve it. Follow-up is by the same team. So, if we need to talk to you about it, we'll give you a call and talk it through.
And I'll just say from a Valleywise perspective, it is the same system as the patient safety, but again, different module. It's called patient relations. And we do have a different team that follows up on those. It's our service excellence department that they're similar to a lot of people call them patient advocates. So it's that department, and but again, they don't have the same protection. They're not protected, and they have different time frames from a regulatory standpoint, whether it's a complaint or considered a grievance that we have to get information back out to the patient. So it is just it's a little bit different, but definitely if you have an issue with, it's a patient relations type, but it is a different process that we follow.
Have you had to produce an incident report, whether it was with the hospitals you're with now or in your careers? And what about the process do you think made it discoverable or even admissible?
I'll start. We have had to, and in the case where we had to, it's because someone emailed it all around to everybody.
Oh, gosh.
So again, do not email these. And anytime you're discussing an event or something, please we put PSWP privilege in the subject line. That helps when we have to produce emails. It helps us identify those and pull those out. And that's patient safety workplace privilege. But once you start sending this information, that includes cutting and pasting verbatim from the event report into an email. That will also make us lose our privilege. So please be very careful with this information. And that's for your protection as well.
And Bill took the words out of my mouth. I mean, don't cut and paste and put in an email. Again, don't try and print it or anything like that. Because again, that's when you lose your privilege, and then it will become discoverable and that information will be out there.
I will say it's possible for you to get an email with this. We can send emails from the system that keeps them protected. And when you reply that email, it replies to the protected system rather than a person. But don't add anyone to it. Just reply to that email. Yeah.
Can we follow up with you about an event report if we don't hear any sort of
Absolutely.
feedback?
Yeah. Yeah. So just call, ask for the risk department, patient safety department. we're one-stop shopping really, so.
And for Valleywise, you'd want to ask for your quality department because that's where we handle it through there.
Or you could just call that pager if you want to, and someone will call back on that as well.
Do you have any examples of problems you uncovered because of maybe several incident reports in a year, and the problem was one that you were able to fix?
Yeah, I'll actually discuss one we're still fixing, I guess. We're working on it. We had several instances in our MRI where with the switching of meds, particularly like vasopressors or critical titratable meds, where there's sort of some concerns of delays. Maybe we're having bad outcomes during that process, and in the MRI department would say no delays, everything's fine. We had some of our ICU nurses saying no, it seems like there's a problem. So we went ahead and we debriefed it, and we actually did a demonstration. We went down MRI and said, show me. There was a lot of kind of I call it folklore here about we go. So our MRI compatible pumps, we only have 5 of them in the hospital right now. They're old. Our regular pumps are not compatible in the MRI, so we have to switch these meds over. And they go, if you want to switch your vasopressors over, you better do it fast. So when we found the process was actually taking far too long, even if we account for a nervous nurse because we're all staring at her, it took far too long to switch over critical meds. And then we're finding that they thought we couldn't stock the MRI compatible tubing on the units because it was too expensive. They're $18 each. They thought they were 200. They thought the meds were too expensive. These meds aren't expensive either. What else? They thought they couldn't gravity prime it. And you had to prime it through the pump, which if any of you have ever done that, it takes a long time. So we uncovered, again, the Swiss cheese. We had about six holes in this process. We have resolved it. We haven't come up with the permanent plan that we're going to roll out. We're still negotiating that a little bit, but we're able to fix this and allow for quick switches of meds. And how the process was working, everyone had a different idea of how that was happening. So yeah, it was a great example.
I would say one for Valleywise was we had had several patient safety events that come through in regards to EKGs being performed on and scanned for the wrong patient through when they would come in through the ED. And as we saw those, then we began kind of discover what's going on. And there was a need for the scanners and updated EKGs in the ED area that we were able to work through that entire process to where we got the scanners to be able to scan your ID badge or the armband, I'm sorry, for the patient. And then since we've implemented all of that, we've had 0 occurrences that have occurred. So it was kind of some of those we kept seeing and it was high, then we were able to figure out the process and what was happening to be able to now we have 0, that we've had 0.
Yeah, and those are perfect examples of why I would love to have you put in more. You're all over the hospital. You have a different perspective than nursing, and maybe it's we have this kind of group think sometimes with people that work together on unit and the nursing that well, this is the way we've always done it. So it's normalized deviance to them, whereas you come in with fresh eyes and say, hey, that doesn't seem right. So put an event report in. We do look at it. Questions?
Just double check there's no questions at Valleywise.
I just did.
Oh, you did.
Okay.
Perfect. Thank you. And if you advance the slide, it has the QR on the next. Further questions?
Oh, all right. Thank you, everyone.
Thank you.